HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
Good evening, Alternative Healthcare Career Group, and of course, the Misunderstanding Dementia Group, the Alzheimer's and Dementia Support Group. But tonight, I'm going live as a physical therapist. We're going to be talking about my journey, our journey on that COVID-19 vaccine. I got my vaccine yesterday. I had it here. I'm sore, and we just wanted to share my experience. And we also have a special guest for tonight. She's also a therapist, and we're going to be talking about our experience in this COVID-19 Moderna vaccine that we got. But before I keep on going, I just would like to encourage you, ladies and gentlemen. See, I'm using my vaccine side, right? You see my muscles there? It's so muscular, right? Ow. So muscular, right? I got it over here, and I'm still sore from it. And last night, I was like, oh gosh, I feel some numbness and everything like that. I feel like I'm numb. And I just realized I just put it on the wrong, angle, and it's already numb, and I just have to put it down, and then, okay, there's blood flow again. So maybe it's my anxiety and everything, but yeah, it's just part of it. So, well, anyway, I just would like to encourage you guys. I'm using my my vaccine side here. Today is Tuesday, right? You already know what it feels like to give up. Let's see what happens if you don't. I don't know who wrote this, but it's so nice. We already know what it feels like to give up. We are, 2020, we want to give up 2020 right now, right? But it says here, let's see what happens if you don't. If you have any goals in mind that you want to achieve, or something that you want to create, something you want to do, sometimes you want to feel giving up. You want to give up 2020 right now, right? But you just have to keep on pushing forward. You just have to move on forward. Sometimes you just have to take the risk of moving forward. Of course, you got to take that calculated risk, right? Again, if you're watching live, please comment live. If you're watching on the replay, please comment replay. And if you got any questions, type in, maybe we can answer. Maybe I can answer. Maybe our special guest can answer too. She's also a therapist. So let's go back to that quote again. You already know what it feels like to give up. Let's see what happens if you don't. Don't give up yet, ladies and gentlemen. There's so much potential in you. There's so much chance. There's greatness inside of you. You're here already. You're watching this awesome show, and just keep going forward. Okay, just keep going forward. Hey there, Miss Kim Huey Farley Land. What is going on? Thank you very much for watching, and for those people who are watching, thank you very much. I appreciate you. If you want to shout out, just type in the comment there, and that way I could give you a special shout out. But for today, a special show for tonight is actually brought to you by the Alzheimer's Disease and Dementia Care Seminar. It is the required course to be a certified dementia practitioner. If you want to be a certified dementia practitioner, if you are in the Alternative Healthcare Career Group, we do this we used to do it every month. I teach it every month, and I haven't taught it for a while, but we will teach again this year. And that way we could educate you how to really understand Alzheimer's and dementia. And yep, that's our special promo for today. Anyway, oh, Miss Kim, yeah. What is going on, Miss Kim? She works at the Unity Psychiatric. There you go. What's going on? There you go. So let's go ahead and yesterday I talked about the different side effects. There you go. Side effects. No, not the side effects. The different stuff about the COVID-19 vaccine I got. I talked about what is COVID, what is the Moderna vaccine, and I promised that we are going to talk about how is the Moderna COVID-19. Though, let me go ahead and type in what am I going to talk about. Type in here. The question here: has the Moderna COVID-19 vaccine been used before? Yes, it says here. The Moderna COVID-19 vaccine is an unapproved vaccine. Obviously, it's still unapproved. In clinical trials, approximately 15,400 individuals, 18 years old and above, have received at least one dose of the Moderna COVID-19 vaccine. So it has been used before. 15,000 people. So one of the many 15,000 people that they already got it. Hopefully, it's including me. Our special guest for tonight. So our special guest for tonight, she is actually an occupational therapist. Her name is Fernanda Faccinetti. I hope I'm pronouncing that right. She's actually an OTR. OTR means occupational therapist, registered occupational therapist. For over 10 years, she lives in Michigan, in a skilled nursing facility. Not in skilled nursing facility. She works in a skilled nursing facility in Michigan. All right, so without further ado, I bring in Fernanda Faccinetti. What is going on there in Michigan, sister? How are you?
Hi, everybody.
There you
Good.
go.
I'm good.
I guess we just want to talk about. I asked people to come over. Those people who has gotten the vaccine. We want to talk about the good, the bad, and the ugly. Right now, I'm the good. There's a little bit bad here. It hurts, but it's just part of the side effects. So, Fernanda, could you share us your experience? Why you got it? Why blah 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 and stuff like that. Could you share your experience?
Yes. So, why I got it is because I don't want to get the virus. I have never got the virus. Thank God so far. And I wanted to protect everybody around me. I'm not gonna lie to you. In the beginning, when I was offered the vaccine, I was very leery. I was like, should I take it? Should I not? It's something new. But when I read the side effects, of the potential side effects of the vaccine, they were so few compared to the symptoms of the COVID that I said there's no brainer. I'm gonna get it. And yesterday I got it. It was the wait. I was excited because it's something new. Is some hope that we're gonna be able to start living life again. And it felt like any other vaccine, like the flu shot that we take it every year. Little poke in the arm. I chose my dominant arm because I sleep on my left side. And uh, this morning I woke up, I forgot that I had taken the vaccine until I picked up my son, and I was like, oh, it's sore a little bit. But other than that, I had no symptoms at all. And I'm so happy I decided to take it.
There you go. There you go. Thank you very much for sharing that. So, where did you put it, on your dominant side or non-dominant side?
For many years, they recommend to do on the non-dominant side so you don't have it. But I usually sleep on my side, and every time I do, I'm like, oh, why did I choose this arm? For the past few years, the flu vaccine, I was like, okay, do on the right side so I don't have no problem sleeping at night, so I can keep this in. Is a way of, because you keep moving your dominant side more often, I guess, whether you
Mhm.
like it or not. So keep the little fluid going there.
There you go. Thank you for sharing that. I got it on my left side, so I don't know if you guys watching, well, which one is which, but this is my left side right now, and because I was on that car and I was in the car. They put it, it's just on that left side there. So it's happened. I'm left-handed, so I did it. So it's really sore for me right now. So you got it yesterday. Do you have any anxiety or anything like that? You felt, you said you felt relief. I mean, can you explain that?
I e- relieved because I really wanted to do this. I was really afraid of getting sick because I had a few people around me. Thank God they recovered, they were okay. But I had a few people around me that got it. So I was afraid of getting it, pass it on to my family. So when I got the medication or the vaccine, I felt like, okay, we're in the right direction to protect everybody and to start getting rid of this horrible virus.
You know what? That's so true. That's so true. I mean, when this virus showed up or whatever, brought to us here or whatever, I don't know. We were like, I hope there's a vaccine, right? I hope there's a vaccine for it. How can we not do this? And then all of a sudden we got this vaccine, and all of a sudden people are like, oh, it was made too fast, blah 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 blah. And I would rather be on the side of the taking the risk, just like driving a car,
Mhm.
ladies and gentlemen. Yes, we're driving the car from point A to point B. It's a destination. And then do you have to know every single part that's moving in that car? No. I mean, the same thing with riding a plane. Do you need to know, this very detailed specific of that plane ride, who's the name of the pilot. Obviously,
Mhm.
sometimes he introduces himself, what buttons that he does. All we do is just trust the system, trusting the
Trust a
process.
specialist.
That's the specialist there. And yes, there may be some sort of, a conspiracy theory that the pilot is drinking, whatever, or drinking
Mhm.
beer or whatever, or alcohol. There's a co-pilot there, and there's the, whatever, the aviation industry to check on him, and there's like, a flight steward that, guides and, looks up after them or whatever they do. And there's a process there. And sometimes that's where your faith comes in. That's where your risk taking comes in. You got to take a
Mhm.
calculated risk, and you want to be on the side of the good calculated risk. These are already good calculated risk. Yes, it was like 15,000 people did the trials and everything. If they're dead, I'm probably going to be dead right now, but it's I'm still alive. And and all I'm saying, all I'm talking about here, and me and Fernandez talk about, sometimes there's a solution already, and yes, it may not be or whatever. I mean, I don't know. There's a possible solution to it. Let's go ahead and try it. Let's go ahead
Maybe
and
we need to take several of them. You never know, but
Mhm.
we're starting.
We will never know if we don't try it. And I myself, I had the COVID. I had friends who had COVID. I had family members who had COVID, and I've seen patients who had COVID and died and recovered, intubated and symptomatic and everything. And uh, I'm just this is the solution already. Not really a 100% solution, but part of the solution that we can do. I like what Karen said here. I always get my shots in my dominant side. I'm not an OT. So do you recommend putting it on dominant side? Really, I guess, right? Because it keeps on moving and blood flow
My
and everything.
my thinking first, it was my sleeping pattern that it disrupted when I started doing on the left side. But if you think about it, they ask you to keep moving to get the muscle going. So if you do on the dominant side, you don't restrict the arm. You keep
Oh,
moving.
you know what? That's true.
So
I
I
put it
guess
here
that
on my. Yeah, it just so happens it's on my left side. I sleep on the left side of the bed. My wife sleeps on the right side, and she hits me all the time. So I said, "Good thing it's on my left side." So she was sore really yesterday.
calculated the pros and cons, which side is better, and figure it out.
You know what? That's so true. Always think with the end in mind. So let's go back. If you're gonna get the vaccine or whatever, think, hey, am I really using what hand? When I'm wiping my behind, when I'm putting on my shoes, when I'm steering my coffee or drinking my coffee, or which hand do I use more for, for like carrying your baby or your child. So always think with the end in mind. Is it going to affect my activities of daily living? Is it going to affect my basic when I go to the bathroom or whatever? Because let's face it, in reality, it is going to be sore.
It
If
might take a day or
you know,
two.
right now, see, I'm lefty, and every time, I know it's TMI, right? Too much information. Every time I'm wiping behind, I feel it. I'm like, oh gosh,
Reminds you.
I felt that. So yeah. Let's go back to the questions here that I have here in the leaflet that I got. Where is that? It says here, what are the risk? What are the risk? Where's that go? Where did that go? So, what are the risks? I'm going to just read it here. What are the risks of the COVID-19 vaccine? So, side effects that have been reported with the COVID-19 or the Moderna COVID-19. What did you get, by the way, Fernanda?
I got the Moderna
The
also.
Moderna too. Okay. Moderna sounds modern, right? So, Moderna. So, it says here the side effects: injection site reaction could cause pain, tenderness, and swelling of the lymph nodes. So, pain, obviously, I got that. I got some tenderness there, and the swelling of the lymph nodes. I actually was checking my armpit, last night.
Nothing.
Good thing for you, mine is sore. So, but just this side here, and I feel it. I hope it's not wet. So, my daughter, she's so nice, and my kids are so good. They texted me just now. Hey, Daddy, how's your arm? They're so sweet. My daughters, I love them. So sweet. Hey, Daddy, how's your arm and your armpit? And I thought she was asking about the smell of my armpit. I said, it still smells the same. And I just realized, my daughter's more sensitive than me. And I texted back, this smells the same. So I put on the deodorant, but she was actually in my lymph nodes. So the lymph nodes, could you tell us what are lymph nodes, Fernanda? So maybe for the people in the other group that don't know anything about this, why there's swelling on the lymph nodes and stuff like that. So
Well, you put me on the spot, but I'm gonna try to pull it out of my deep brain here. So there are glands right under your armpit that, in case when you have an inflammation, they get swollen, and to fight off the inflammation. So everything there is foreign, kind of activate that for some people. So in my case, they were fine. No pain, no swelling, no nothing.
there you go. There you go. Thank you for sharing that. So just like what Fernanda said. So lymph nodes are basically our glands or small glands in our body, and it's like a filtering mechanism. So if you have like a water filter at your home, or like the air filter in your air conditioning, and that's the filter. And obviously, when you have infection, and then there's a like infection or a foreign infection, foreign body, or whatever you call foreign thing,
Something that is not supposed to be there.
that's not supposed to be there. That's your filter. So when you take off that filter in your air conditioning, it's dirty, it's dusty. Same thing with your body. God created that lymph nodes, and it means there's this foreign body or not supposed to be there, and it's getting swollen there. And it doesn't necessarily mean you're sick. It's just reacting to it. And once it develops that antibody or recognizes that, that's when you start creating some sort of a reaction, or developing that immunity to it, hopefully, because it's still unapproved. So we're just on that side here of, hopefully it works. Okay, so let's go ahead and keep on talking about the risk here. Other side effects, the general side effects is fatigue, or obviously I'm always fatigued. Headache. My wife always has a headache from me. Muscle pain, joint pain, chills, nausea, vomiting, and fever. Basically, it's all most side effect of most vaccines anyway. So it says here there's a remote chance that the Moderna COVID-19 vaccine could cause severe allergic reaction. I'm not saying everybody will have good, everybody has bad, and everybody will be ugly, but there'll be a chance of that. So if you have that signs of severe allergic reaction, obviously includes difficulty breathing, swelling of your face, in your throat, and when your throat is swollen, you can't breathe. Fast heartbeat. If you got hyper or tachycardia. Bad rash all over your body. It means your body's reacting to it, and obviously dizziness and weakness. So if you have that, obviously call 911 and go to the nearest hospital. That's it. I guess that's it. So, how about you, Fernanda? When is your next? Are you gonna have your next dose? Are you up for the challenge and everything like that?
Oh, yeah. In about, I would say, I think it's 28 days is the next dose. And yeah, but I hear that you feel more of the side effects on the second dose than the first one. So we'll see. But even those, I'll take it. Even if I have some of those side effects, I'll take it again. Where I took it, they asked us to wait 15 minutes just in case we had any type of immediate reaction. So we had to sit there and wait a little bit. And everybody that waited with me, nobody had anything. I didn't see no reaction.
You know what? That's true. Me too. When I went to the health department, they asked me to wait for 15 minutes. I explained that to you yesterday. And I had my student with me. I said, something happens. Come on, you know what to do. And I mean, there were like ambulance there, and even the EMTs, they got their shot too, obviously. And then there were like different cars there. And I mean, obviously the ratio and everything. But there were like, I think 10, 15 cars lined up. There was no emergency there. So I didn't see any, siren
No.
or anything. So when that 15-minute or that, I was there for like 30, 45 minutes waiting for paperwork and everything. No reaction. Uh, it's more like my anxiety. I don't
Hmm.
know about you, Fernanda, but for me, I was like, oh gosh, I'm waiting for it. Because, ladies and gentlemen, I got tested positive in COVID, but I was like considered it wasn't that bad. Now, and every time when I had the actual COVID virus, I was waiting for the times like, when am I gonna have a hard time breathing? And I was just
Hmm.
anxious about it. I was telling my wife, give me some ginger, make me some ginger tea and everything. I'm just drinking and everything. And every time I'm swallowing, and I'm like,
Yes, yeah.
I'm like going to the wrong wrong area. I'm like, oh, this is it. And I was anxious about it. And every time I'm breathing like this, I was more anxious. And same thing what I felt yesterday, and I was waiting for it. And I know it's real and everything, but uh, for me, it's more like I have to redirect my mind to so I wouldn't get those symptoms and everything. Last night I was nurturing it, I was babying it.
Oh,
Oh, it hurts. It's gosh. And then today I work, I saw like I think 5, 6, 7, 8 patients. I forgot about it until now again. I was like, oh gosh, it hurts now again. I mean, sometimes you just have to learn how to redirect if you have those symptoms. Now, of course, if it's a severe allergic reaction, you
yeah.
know. All right, Fernanda, any last parting wisdom for our friends and family who are watching right now, and special encouragement for those people who are still, thinking about, am I supposed to get the vaccine? Do I need to get it? Wait for, a better brand or a trial and everything like that. So, any special encouragement for our friends and family?
I'm I have a friend that he's a doctor. So when I was offered this medication, I asked him, I was like, what should I do? Should I take it? And he's like, I'm not going to tell you what to do. I'm going to tell what I would do. I would take it in a heartbeat. And so I'm not going to convince you to do it. You read about it, do your research. There's always a risk. So you have to be willing to take some risks. So if the for me the risk of the side effects were this big compared to the symptoms, the long list of symptoms of the COVID. So for me it was a no-brainer. I said, okay, let's do it. And of course, the new technology of the vaccine gives you a little bit of anxiety, but if you read about it, it's very promising. And if I have to take the other ones, I'll get in line again and go take the other one. But I'm glad I took the yes route to take this vaccine. So
Thank you. Mhm. So yeah, I mean, me too. We're on the. This is, it's a new vaccine. You want to be on the side of history. I took it. Now it's, you know, on a funny note, we're gonna die anyway. I mean, this is at least it's controlled. You know, it's controlled. If something happens to me, and I know I got the vaccine, it's controlled. Unlike when I got the actual virus, it's gonna be, I don't know what's going on. Is it gonna be too bad, or I don't
you
know.
don't choose the kind of the virus you get, if the light side or the all symptoms kind.
Yeah,
So
you
some
know.
people are asymptomatic, they have nothing, they go by their lives like nothing's happening. Some people have a full blown list of everything. So
It's so true. That's so true. Somebody commented here. My supervising PT husband just died from COVID. He was in his early 40s, no underlying health issues, uh, active and in great shape. This is real. I mean, I know I laugh and everything, but this is real. I mean,
mhm,
I just evaluated a patient, uh, same age as me. He's homebound now. He was still working in engineering and everything. He's homebound now because of the COVID. And he was healthier than me. I mean, I'm taking blood pressure pills, I'm taking cholesterol pill, I'm taking, diabetic metformin and everything. And I want everything controlled. I mean, even the medication I take, there's always a side effect. My blood pressure pill, the side effect, I mean, atenolol. I'm taking beta blockers. Do you guys know what the side effect of beta blockers? So if you know what the side effect of beta blockers, don't even talk about it.
yeah.
But I have to take the risk, because what do I need? My doctor, he was just like, Michael, what do you want? Impotence or high blood pressure, you get a stroke. I'm like, okay, I
So the
just get a
benefit
stroke.
outweighs the risk, right?
You know, so you just have to weigh the risk. You just have to weigh the risk. And every medication, every vaccine, everything, there's always a side effect. And just this lady, I can't see who she is, but it says here that that gentleman, rest in peace, my friend. Uh, I'm so sorry. He left behind two young teenage children too. So it's real. Let's be part of the solution. Let's get it. You know, and be on the positive side of the history. And I mean, we were asking for this when this virus came out. We might as well, use it. Yes, I don't know. A lot of people will say, it's unnatural, blah 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 blah. I'm not healthy. I take blood pressure pills. I can't be too much. I can't be what you call this. I can't be supernaturally healthy. So yeah.
There's a lot of misinformation out there, especially on the internet, that makes you afraid. Of course, I was at first, and I kept reading. I said, "Hold on, stop. Go look for the uh, credit credited information, the CDC website. Don't read what a doctor somewhere thinks about this." And I think that's what a lot of people are afraid, because there's so much misinformation out there about all of this, about the virus, about the vaccine, that it makes you confused. It makes you not want to take it. So you have to really filter those information out to get the true about this.
That's so true. Thank you for pointing that out. You got to make sure you're. I mean, same thing with what do you call this? I keep on harping on it. My medication. do my blood pressure pill, atenolol. There are different brands. I used to work in the pharmaceutical industry, and I know the pharmaceutical industry. And yes, it's like, oh, there's the pharmaceutical industry. It's just something behind there. I know general managers. I mean, they're and stuff like that. But what I'm talking about here, do I really need to know the pharmacokinetics and the pharmacodynamics of that specific medication? I know it because I used to sell those medication. But when I'm taking it, do I really need to know it? Do I really know that what the medication, when I take the metformin or my atenolol, when I swallow it and go to my stomach or whatever, do I really need to know, hey, it right now, it's slowly disintegrating the 2 milligrams of it. No,
Mhm.
I just trust my doctor to to he's doing a good job. That okay. That's the reason why we got doctors. Betty says, uh, Betty, there you go. Hey, Betty. I don't know why my name is that. Sometimes Facebook is just weird. Sometimes that should show, or if you haven't clicked any buttons yet, so sometimes that happens. So sorry about that, Betty. But thank you for watching. So for doing that. And another Facebook user is says, I have a real issue with the people at work who don't wear a mask, even though it is a mandate where I work. You know what? It's true. We got to do our part. And this is a great uh, opportunity to educate also. There's, I mean, sometimes, you know, I don't know where you work or something, but obviously in where we work in the healthcare, it is really mandatory. It's a requirement, you know, and
Mask, shield, everything.
mask, shield, the whole shebang. We got the headgear, the foot stuff, everything. Oh, I guess this is Betty again. So there you go. So yeah, we just have to be on top of it. And like what I always say, ladies and gentlemen, if you are not part of the solution, you are part of the problem. So let's be part of the solution. If you don't want the vaccine, protect yourself, use, mask. And there are still people who are still, saying that mask is not good. I mean, it helps. Come on now. Why do you think surgeons wear masks during surgery?
Hmm.
When they're talking, there's spit coming out. You don't want that. There's spit. I'm sure your surgeon is clean. They brush their teeth and do mouthwash and scrubs their hand and everything. But you don't want that surgeon talking without the mask on and spitting on your open body there. Exposed body. When they're doing a knee replacement or whatever kind of surgery in your body, and it does work. So just please protect yourself. And be on the positive side of history. So again, Fernanda, any last parting wisdom? I already told you. I already asked you that. So any special encouragement for those people out there?
I'll say let's do what it takes to get over with. If you don't want to take this vaccine for some reason, some people have medical issues that cannot take it. They wish they could. I met some people at work that had some medical issues. They're like, I wish I could take it, but I can't. So just social distance, wear your mask, try to contain this so we can go back. My job is not the same right now. I used to work full time. Now I work here and there. So I want to go back to work to help people to do what I meant to do, So let's all get together. Especially in the health field, we understand this. We understand the biology of this. Let's get together, get the vaccine, wear a mask, social distance, because you and I, we're not out of the woods yet. We still have to do everything, stay away from people, and until we get the second dose and make sure that we're uh, okay. So do what it takes, whatever it takes for you.
Amen. Amen. So, well, somebody, I think this is Betty again. Yeah, it is their right not to everyone. That is one of their rationalization. You know what? It's also your right to be safe. You know, and just like let's just say, let's just say riding a car. You know, it's also our right to be safe. If they're not wearing their seat belts. There was a time. I was watching the evolution of seatbelt, where I think it was Volvo. It's a Volvo commercial, and then all these people was against using a seatbelt because it's like, oh, it's restriction. Oh, it's, I would rather be thrown in the car than wearing seatbelts or stuff like that. It was really nice video. And it's also the same thing right now, what we're having right now, wearing mask. Yes, it feels like, it's not nothing political about it. It's just like that seatbelt. It's for your own safety and for other people's safety. If that driver behind you or beside you is not wearing seatbelt, the tendency for them to have an accident, if they move around because they're not really protected uh on that position there, and they could throw themselves inside the car with high speed. So, all right. So, there's the she agrees. Thank you very much. And Luigi Nictao Bondok. Hello, Luigi. I hope I'm pronouncing your name. I heard you have to wear a mask at home after vaccination for family protection. Is that true? Did anybody mention you that,
No,
Fernanda?
I read the paper that they gave us, and then I look at the CDC website. They didn't say anything. And if I was supposed to wear, it's been 24 hours since I got the medication or the vaccine, and I've been with my family. I haven't worn anything at home.
That's a great question, Luigi, or however you pronounce your name, Nick Dao Bondok. I know a Bondok in the Philippines. He's like a famous dude. He's like a singer or something. I hope you're not related, or hope you're related to him. But yeah, I wouldn't, because there was no, of course, everything is changing, but it's not here in the notes that they gave us. So I would say you don't have to. It's another fear tactic or whatever, because apparently they think that you're being injected with a virus and you think you have a virus, so you got to protect yourself. But still, if you feel like you are getting sick, obviously when when you get the vaccine and you feel like you're getting sick and sicker and you got, some bad reaction to it, obviously wear one to protect your family. I mean,
And
it's
I
all
think
about critical thinking. And that's
especially
what's
this
getting
kind of
lost in the
vaccine.
translation. Oh, I'm sorry.
Sorry, especially this kind of vaccine that we got is not a live virus, so I wouldn't think it take a while for our immune system to respond to that. So I don't know. I don't know. I have to, once I'm done here, look it up, but I don't think I haven't heard anything like that.
Okay. Well, me too. Our goal is to have a critical thinking mind, common sense. Common sense. If you have the symptoms, go ahead and wear one. Protect yourself, isolate yourself, and stuff like that. Because common sense is not common practice nowadays. I
Hmm.
mean, you'll see people driving with their mask on and they're just by themselves in the car, you know, and then they're inside the store and they're not wearing the mask. So let's go ahead and bring back our common sense. If you have symptoms after the vaccine and you're getting sick from the vaccine, and you're developing a reaction, go ahead and mask up, isolate yourself. You got fever and stuff like that, go ahead and isolate yourself and mask up. All right, any last parting wisdom? I already asked you that. um
Do
where
it. Just
where
go and do it.
where do you think we can reach you, Fernanda? What what email or website where we can reach you, or you're good?
You can. I'm on Facebook. You can look it up on Facebook. Um, I guess that's can give me my email, but it'll be complicated. I'll probably have to type it here.
Mhm.
um, and I'll be willing to share the second dose reaction also, because I think it'll be more important, because you'll be the full closure of everything, because so people be willing to try.
There you go. I hope we're still both alive, right?
We will. We
All right.
will.
Okay. Again, thank you very much, Fernanda, for your wisdom, for
Yeah.
encouraging us. I appreciate you for your time and effort. What time is it there? It's 10 o'clock because you're in
It's,
Eastern time, right?
we're night owls over here, so we're okay.
Well, again, thank you very much, Fernanda. Appreciate you. Again, before I let you go, ladies and gentlemen, always remember the word fast, FAST. Letter F, Find friends that will push you to your next level because you are the average of the 5 people you hang out with. So who are you hanging out with? Today I hang out with Fernanda. She's a fellow COVID vaccine 19 survivor. Woo! And, we're going to get the second dose. Go ahead if you are wanting to get one. Go talk to your doctor. Obviously, if you got pre-existing condition, your immune system is immunocompromised, obviously don't get it. Your doctor will know better. Talk to your physician about it, nurse practitioner, or PA, or whatever that you go to, your primary care physician. So go talk to them. They know more about you. We don't know. I don't know. You're not our patient. So find friends specifically that will push you to your next level. Next letter on the word fast is letter A. You gotta learn how to take action. Now is the time. If you have the opportunity to get the vaccine, go ahead, take action. Take action because imperfect action beats perfect inaction. This is the perfect time for us to change the world. Yes, it's unapproved and stuff like that, but take the risk. It's a calculated risk. All right. Next letter is letter S. Shoot for the moon. Why? If you keep shooting for the moon, you're going to miss it. You're going to be landing with the stars. Tonight, I'm landing with the stars with Fernanda Vaccination. Oh, I hope I'm pronouncing that right. And last but not the least, letter T. Teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it more. When you get the vaccine yourself, share your experience to other people. Share it to them. Educate them about it. Hey, I got the vaccine. It was sore. It hurts. My lymph nodes hurts. My armpit hurts. I got lymph nodes here in your neck, or in your armpit, and your groin, and in the back of your knee. So whatever, it got sore, but I'm good. Share it to them. Share your experience, because like what I said, the more you teach it, the more you actually understand it. Again, thank you very much, ladies and gentlemen. Thank you very much, Fernanda. I appreciate you, my Facebook friends, wherever we're streaming this, in our podcast and our show, YouTube channel, Alternative Healthcare Career Alzheimer's Group. Again, appreciate you. Be awesome, be great, be excellent. And we will see you when I see you, Facebook friends. Bye-bye.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.